So your time starts now.
Mhm. Good morning. I'm Dr. Naresh. I'm one of the clinical candidates for this is my assessment sheets.
Good morning, doctor. So you have to examine Sarah. Sarah is 4 years old and she has some difficulty in walking.
Oh,
So examination.
okay. Okay. Thank you. So I'll just go in front of Sarah. Hello, Sarah. What's your name?
Sarah is running here and there in the room.
Shahir.
She looked at you and smiled.
She to tell me. Okay. Is Sarah is accompanying with his mother or your father?
Father.
Father. Hello, I'm Dr. Naresh. I'm today actually one of the exam candidate. Today actually I have to examine Sarah's. It's Sarah's like how actually she walks. Is it okay with you?
Yes, it's okay with me.
Okay. So first of all, actually, I will look for if the Sarah is any unusual features.
No facial features unusual.
Okay. And what about the dimension of Sarah?
A bit small for her age, height and weight.
Okay. What about any devices around?
Not attached.
Any is she in a distress or is she well looking or distressed?
She is well looking. She is happy go child, running here and there.
As you said, actually, he's having a difficulty in walking. What about his gait?
She's
She's
she is walking. She is running actually
running and without any difficulty.
without any difficulty.
Okay. And then actually like to look the Sarah from the front. Is there any deformity
Where exactly?
in the lower limb?
Yes, the bow legs are present.
Bow legs are present. Any asymmetry in the bow in the lower limbs?
No,
Any this as you said the bow? Any muscle wasting?
a bit wasted, not much.
Not much. Any this scar in the lower limb?
No,
Any rash?
no.
Any this thing stigmata of the neurocortex syndrome?
Pardon?
Stigmata of the neurocortex syndrome.
Not present.
Okay, this is like the front. On the sides, if there is any this arching of the this foot,
No,
any scoliosis, any lordosis.
not present.
Okay, and from the back, is there any scar,
Not present.
any wasting of the muscles, any hypertrophy of the muscles?
Not present.
Okay, so I found that Sarah is basically having only found the board leg. I like to take the Sarah on a couch. So I'm going
Okay.
to take the Sarah on the couch. Okay.
Sarah is sitting on couch.
Sarah is sitting on a couch. Okay. Then I like to basically look for the general from head to toe. What about the is there what about the this macrocephaly?
There is no microcephaly.
No, any macrocephaly? Macro,
No,
large head.
no microcephaly. Forehead is a bit prominent.
Okay, and frontal bossing
Uh, yes, present.
present. Okay. Then I like to basically take a permission from the Sarah. Like actually, can you please expose her chest?
Exposed.
Any racketing rosary?
Not present.
Any sulcus, Harrison sulcus, or any extra excavatum or like this? No.
Not
Hello.
present.
Any
Not present.
this
Not present.
any spots? Any spots over this front and back?
Not present.
Okay. Then actually, I would like to go for any widening of this lower limb. Sorry, this wrist. Radioulnar joint
Present.
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 Okay. Any protuberant abdomen?
Yes, present.
Protuberant abdomen. Okay. So if there is any signs of the general physical or general any signs of the chronic disease like in from the clubbing, cyanosis, or anemia or jaundice? No.
Not present.
Okay.
Slight pallor is
And
present.
slight pallor is present, and he's four. Okay. So this then I would like to basically look for this as actually she's having the board legs. So I would like to basically look for the any tone. What
Tone,
about the tone of the lower
normal.
limb? Normal muscles, waist no,
Tone
so
normal.
reflexive normal, power normal. Okay.
Yes.
Hello. Power normal.
Yes, yes. Power normal.
Okay. Okay. And any what are the reflexes?
Reflexes are normal.
Hello? Your voice
Reflexes
is
are normal.
echoing actually. Comes late. Okay, so that completes my examination. So I'm going to present this case to you that today I examined Sarah. My task is basically given that he's having a difficulty in walking. On inspection, I found actually she's running and she's running comfortably and she's having the board legs and having the macrocephaly. Sorry, this frontal bruising with widening of the radial ulnar joint. There's a protuberant abdomen and otherwise this is normal. So my diagnosis goes in favor of this. It could be a case of the rickets, nutritional rickets.
Okay. So is there any other differential in your mind?
There is a one is called because she does not have any neurological, so I cannot put in this neuro5 type 1. But otherwise, the differential is called Brown's disease.
3 minutes.
Yeah, Brown's disease.
Okay.
Other differential is called Brown's disease. Brown's
Okay.
disease. Mhm.
So how you will manage Sarah?
How will you manage? I will like to take a complete history and complete examination from the head to toe. I would like to plot his weight and height and appropriate growth chart, and I would like to this take his vitals, take her vitals, including saturation, and I would like to basically this my investigation part. I would like to go first for this complete blood count to look for any anemia, and
So considering this child has rickets. So how you will investigate this child?
yeah, I'm same. I'm saying the complete blood count to look for anemia or any sort of infection because the children, the rickets children, they have a prone for infections. Then my investigation goes in favor of the serum calcium, serum phosphorus, alkaline phosphatase, and PTH, and the X-ray of the left wrist joint, AP and lateral view. And my I'm expecting there is a basically could be cupping, could be fraying, could be this rarefaction. I'm expecting there.
Okay. So what specific treatment would you like to give?
Once actually I did my investigation, then I like to basically treat Sarah as competitive. If it is a nutritional rickets, then I would like to treat accordingly. And if there is a not nutrition, the treatment differs. But most of the cases it is nutritional rickets. So I would like to give this the doses of this vitamin D as per his age with maintenance and plus calcium as per the
So
BNF.
okay, so in what dose would you like to give?
I will like to give the vitamin D, that is basically a single dose. I have to look for the BNF. I like to give a single dose of vitamin D and then maintenance dose every day plus calcium. And I will like to basically look for the nutritional. And one more thing, actually, if possible for the parent, then I would like to ask to have this sunlight at least for 15 minutes from April to October. So I think April, yes.
Okay,
Yeah.
right. So anything else you would like to do?
And dietary management is very important. Dietary management, this food rich in vitamin D, the sunlight is very important. And
Mm.
these are my this sort of this treatment part.
So the time is over.
Thank you.
Thank you, doctor.
Thank you.
Okay. So once we enter the room and we introduce the examiner, and the moment we get our task, we have to do hand hygiene.
Yeah, hand hygiene में हमेशा भूल जाता हूँ यार. So difficult. I do it a clinic with every patient. Why I'm forgetting it, I
Yes.
don't know.
Once you are done with your examination, once the bell rang, then at that time, or once you are done examining your patient and with patient, then you have to thank the patient. Okay,
Thank
so
you बोला था.
that is
Thank you मैंने बोला था.
yeah. So that is also very important.
Two things actually I forgot. The wipe, this wash and this in between the keeping this rapport with the patient.
As your task was do general physical examination, so you have to do from top head to toe, and that is good. But when you are done with head and neck, start with hand. Okay,
Yeah.
the way we approach CVS and respiratory and abdomen cases same, because then only you will come to know whether there is broadening of wrist or not. Okay. And as this is general physical examination, so there is no need to go into neuro examination.
Okay. Okay.
Okay.
Thank you. Thank you. Thank you so much.